You're watching Houston MediaSource's WTP-TV, We the People Television's 24-hour coverage of World AIDS Day 2006. 24 hours of enlightenment, education, and hope.
Hi, I'm Ilham. We're doing a Pakistani Point of View today. I have two guests with me, Dr. Aftab and Dr. Rauf. Dr. Aftab is a research fellow in Michael D. Bakey Department of Surgery at Baylor College of Medicine. He has done 4 years residency at Mayo Hospital in Lahore, Pakistan, has received a Scholar in Training Award by the American Association of Cancer Research, and is a member of Muslim Health Professional Society and UPNA, which is Association of Pakistani Physicians of North America. Dr. Shariq Rauf, he's board certified in infectious diseases in private practice. He's a former assistant professor at in infectious disease at UT Medical Branch, UTMB Galveston from 1996 to 2004. He has been in the practice for about 10 years. He has extensive research in AIDS clinical trials at UTMB and has treatment of AIDS patients in the correctional care facilities in Texas, and is also a member of Islamic Medical Association of North America and of UPNA. I welcome both of you today.
Thank you.
We are going to basically talk about the Pakistani point of view. And Dr. Aftab, I have a question for you. The first confirmed case of AIDS in Pakistani citizen was in 1987 in Lahore, Pakistan, which is a bigger city of Pakistan. In your opinion, what is the reasoning behind the report being so recent? I mean, could it be because there weren't means of detecting HIV at that time, or are there other reasonings behind it?
First of all, I will thank you to give me the opportunity to talk to you and share my personal experience. And actually, the first patient diagnosed in '87 and in Pakistan, if you look back at the history of AIDS, AIDS virus, which is AIDS mainly caused by HIV virus, human immune deficiency virus. And HIV virus was named as HIV in 1982. And before that, there were different names given to HIV virus, and there were many myths and stories about HIV. And there had been a long area of silence about the epidemic of HIV in late 70s. Moreover, in 1985, for the first time in the United States, FDA approved a test based on serological analysis, and it was based on the presence of antibodies in the blood of the patient. Mm-hmm. And first patient was detected in Pakistan in 1987. So it looks like that there is no much difference of the time in the chronological order, and it's very natural that in the developing countries, the time lapse of 1 to 2 years is not a big time lapse if we consider the shift of high-tech, all the high-tech medical facilities. Mm-hmm. So I think that it's the natural history of AIDS in Pakistan.
Okay. I want to talk to you about the physicians in Pakistan. Do you think they're trained enough to be able to detect if a person has HIV, if they had come across them?
Yes, they are. But you know, it's the training of physician is highly variable depending upon the physician's experience and type of the patients and the patient load they are coming across and they're going to treat. Suppose in the United States, if some physician come across a tuberculosis patient, and most of the physicians don't come across a lot of tuberculosis patients in the US. So they will not be very much comfortable in treating tuberculosis patient. They may have to consult ID. But in Pakistan, every physician who is under training, he knows very well how to treat the tuberculosis. In the similar way, because of low prevalence country of AIDS, that incidence of tuberculosis and prevalence of, incidence of HIV and its prevalence is extremely low in Pakistan. So the training of, although the physicians know the literal knowledge, but the real training experience, because of lack of patients, they don't have much training experience. But they know how to treat the patients, and there are the facilities for diagnosis and follow-up too, especially in tertiary care centers.
So you're saying that if they had more experience, if they had more patients come with AIDS, then they would have more experience, but then they'd be able to better
Exactly, I agree
it.
with you. And there is a huge percentage of physicians who had been trained abroad, like Europe, UK, or USA, and they went back to Pakistan.
Oh.
And they are contributing a lot to the health system of Pakistan, and they are very well experienced about treating the AIDS patient. But of course, we don't have a huge number of physicians who are very well trained in treating AIDS, because it's not our major health issues. A major health issue in Pakistan is hepatitis. A lot of every physician know how to treat hepatitis patient. Every physician know how to treat tuberculosis, because these are major health concerns in public.
How would you say is the prevalency of HIV in the Pakistani society?
As I told you, Pakistan is still among the very low prevalence countries. The prevalence of HIV in Pakistan is 0.1%, according to United Nations parameters, UN AIDS program, and this is the recent data in 2004. If we further split that in the number of the patients, according to UN, although the diagnosed patients, the people who were diagnosed and reported for having HIV positive status, they are only few thousands, like 2,500 or 600. But according to UN, recent UN report, there are 70 to 80,000 patients having HIV positive status in Pakistan. And most of the patients are of age between 15 and 49 years. And if we further split, there are almost 1,000 children or kids which are having HIV positive status because of the transmission from the mother, or in the fetal life, or because of the breastfeeding. And and the women diagnosed of having HIV positive status, they are only 9,000 out of these 74,000 population. So right now, Pakistan is among the very low prevalence countries according to UN criteria. But of course, there are chances, and there is a need of prevention as far as the measures are concerned.
Okay, let me ask Dr. Rauf. You've been treating AIDS patients for quite some time now, and you've done a lot of research in it. I would like to know, could you talk about the role of Muslim physicians in the treatment of AIDS in the Western media? Or
if you look at the institutions in the United States, there's quite a number of physicians of Muslim origin who are involved in direct AIDS care as well as in research. And personally, I've been involved in the treatment of AIDS for the past 10 years. And the number of patients that you come across and see are in the thousands. So there are many physicians of Muslim origin who are actively taking part in AIDS care and in AIDS treatment and in AIDS research in the United States. It provides benefit to patients within the United States, and they carry their knowledge to the countries that they go back to.
what are the types of programs that they might be involved in that helps the society over here?
There's a large AIDS clinical trials group that carries out clinical trials for AIDS patients. People are involved in that. Direct patient care in the community and in the academic settings as well.
Wow. I would say with knowledge comes power, and its absence leads to darkness. Only 56% of the Pakistani population is literate. compared to the average 49 in South Asia and 53 in the low-income countries within the world. With that in mind, what are the misconceptions and stigmas that are associated with the disease in Pakistan?
As Dr. Aftab stated, the incidence of AIDS in Pakistan is very low. With these new diseases and increased recognition, obviously there's stigma associated with acquiring the disease. There are incidences of social isolation, lack of family support. But during my practice in the United States, I've seen that in low prevalence areas, even in the United States, that stigma remains. So it's not something that is unusual or would be specific to a Muslim country or Pakistan. There are situations, even in the Western world, where in low prevalence areas, social acceptance is still low. So you would expect that in Pakistan as well.
So you would say it's basically how you would feel over here. You might feel the same stigma over there.
It would be quite similar.
Mm. Yeah. Now, Dr. Aftab, I wanted to ask you, to the best of my knowledge, most of Pakistan, majority of it, is in rural areas. So what is the government doing? Are there any initiatives that they take to educate the population in general over there?
Yes, exactly. Your question is very important and interesting. Recently, government of Pakistan has taken a lot of steps regarding the public awareness about AIDS, and they are utilizing all the print media and television opportunities. The recreation time in Pakistan is usually on television is 9 to 10 p.m. and everyone will come across a lot of ads by the government of Pakistan, by the Ministry of Health, in collaboration with the UN AIDS program, US AIDS program, which are supporting to some extent the government of Pakistan too, for increasing awareness of AIDS. And they are utilizing television, but the general impression of public is that few people think that these ads are really unnecessary because AIDS is not their own issue. AIDS means they don't have the major epidemic of AIDS in their society, and because of many cultural reasons, as we know, the prevalence of AIDS is very low in Pakistan. People think that our main issues are other infections, other diseases, which are more prevalent among the people, poor people and socially deprived community. So, there are a lot of Mayors tertiary care centers. They celebrate AIDS Day, and they distribute pamphlets. There are general awareness lectures among community, and they are mainly arranged by tertiary care centers, but even the rural health centers nowadays, they have many campaigns about AIDS awareness, and a lot of NGOs have stepped forward to make the community aware of aware of AIDS, because the general impression about AIDS in Pakistan is that it's a death sentence, and it's a disease which is incurable. It's true too, but there are a lot of measures to be taken, and the government of Pakistan is taking a lot of measures to increase the public awareness.
Okay. And do you think the public appreciates what the government is doing for them?
It depends upon the individuals. Few people who are educated and who are well aware of the AIDS, they really appreciate it because it's our necessity. And I think that in the country of low prevalence, the only standpoint to prevent the AIDS epidemic is by prevention. And but there is a class of people who are who think that they are not going to suffer from AIDS because they don't have promiscuous lifestyle in their and because of the cultural reasons, most of the people in Pakistan, they are confined to their own sexual partner, which is through marriage. So they think that because majority of population think that its transmission is by sexual contacts, and because I am confined to my own partner, so there are no chances for me to contract this disease. So in this sense, you can say that people think that it's not my issue. A lot of people think.
Understandable. Dr. Rauf, there are at least 36 million people in Pakistan that fall below the poverty line. And people have limitations getting proper access to healthcare, let alone treatment for HIV. Now, how do these people become an obstacle in HIV or AIDS efforts from the government?
Well, we have to look at the population and see that there's a very select group of people who have acquired the virus. It doesn't really follow a poverty pattern, whether they're of a high socioeconomic group or a low socioeconomic group. So I don't know if this question really is applicable, but the availability of education through the media and through the electronic media is accessible to even the rural villages because of electricity and the availability of televisions even in the rural areas. So the dissemination of information that occurs is not confined to one group of people. I don't think it follows a pattern of privileged versus unprivileged people.
Makes sense. Dr. Aftab, it seems like AIDS spread faster in larger cities than in rural area. There's a higher percentage of AIDS patients or patients affected with HIV in, say, Lahore, which is one of the larger cities of Pakistan. Now, these people have access to healthcare facilities, they're more educated, they have more knowledge. So what is the reason why the number of the AIDS patients higher in those areas compared to, say, a village where there's not enough education for people?
Yes, actually, it totally depends upon the lifestyle. And as Dr. Rauf was saying, that the people living in the villages, they have access to all the print media and television, and they are equally aware. And unfortunately, it's paradox that the people living in the urban areas, the prevalence of AIDS is more among the people living in the urban area. It's many factors are actually affecting this paradoxical distribution of the AIDS patient. One of the factors is the lifestyle. People living in the villages or in the rural areas, they are more conservative in their lifestyles, and the people living in the big cities, they migrate, they go abroad, they contract the disease. There are higher chances of them moving around. If we look at the first incidence of AIDS, first patient diagnosed till now, a majority of the population of the patients who are having AIDS, they have been to abroad, or Middle East, or a few European countries. And when they came back, either they were diagnosed having HIV positive status there, or they were diagnosed and they were sent back to Pakistan. So if we specifically look at that, the factor one is the travel abroad, and of course there are few pockets of the people who are commercial sex workers, and there are few communities of those people, and it's mostly in urban areas, not in the rural areas. So it's one of the reason, and the third reason is IV drug abusers. The access to these drugs is more common in big cities. So there is a huge population and community of IV drug abusers in big cities, and these are the people who are poor, who are deprived, and because of their addiction, and because of the social confinements, and because of their craving for their addiction. That's why they usually use the contaminated syringes, and they are the people who are a third pocket of community having a high prevalence of AIDS, and and the majority of these patients are also in big urban cities. So these are three major factors affecting the prevalence of the disease in big cities as compared to the rural areas.
Do you think these groups, or the pockets, as you say, Are they mobile? Are they confined to their own groups, as for example, drug users would be? Do you think it's easier for them to use drugs, be drug users, and integrate into society, and then spread it to someone else?
Yes, exactly. Because they are not totally isolated from the community, and they are interacting with the society. Everyone is having his family, and the people coming from abroad, a lot of times they don't know their HIV status, and they are diagnosed just incidentally. I came to know a few patients that who were diagnosed when they came for volunteer blood donation, and so there are chances that those people they can disseminate the disease, and they can transfer the disease to the other people in the society, and I think this is the specific area on which we have to focus. We have to focus most of our efforts on the high risk population, so that we can decrease the high risk population, and we can make our community on another side more aware about the prevention of the disease. This is the only way we can combat with the AIDS in Pakistan.
Very good. Dr. Rauf, I'd like to ask you, homosexuality is not very prevalent in Pakistan, or at least it doesn't get exposure over there. Could you please explain the means of spread of AIDS in the general population in Pakistan?
I think we've talked about this a little bit already with Dr. Aftab. He's mentioned out some and given some figures. Your question is what population group we're dealing with that is involved with it, or who has contracted HIV, or how it's spread. The majority of spread is heterosexual contact still. The figures ranging by around 35 to 40%. About 4 to 5%, is that correct?
Yes.
About 4 to 5% is homosexual contact, 15 to 20% intravenous drug use, mother to child around 1 to 2% mother to child transmission, and homosexual contact is around what the figures that have been given out, around 5 to 6%.
Okay.
So it's still a very low number. And when you look at the population, when you're looking at maybe 60 to 70 or 80,000 individuals, and of that 6% comes out to be a very low number. There is one interesting study that in Karachi that they've recently done, and they've looked at a group of intravenous drug users who were probably within a community using intravenous drug use, and they did antibody testing in that group, and they found 25% of that group to be positive. In commercial sex workers, that means in prostitutes, another study showed about 8% positive. Now that's a huge number, and you can see that it's very easy to spread the disease through intravenous drug use or through sexual contacts when people visit these areas, which are areas of prostitution, and they can acquire the disease and spread it to within their family and then on to others. And if they spread it into give the disease to their wife, they have a child, and the child could get infected. So, but those are the major means of spread.
Okay, I think we're short on time right now. I'm getting the cue. So I would like to ask real quickly, Dr. Aftab, blood transfusion is one means of spreading the disease. Are there methods to screen people before they are tested or they donate blood, for example?
First, I would like to add among the epidemiological splitting of the patients and to Dr. Rauf, that 18% of the patients suffering from the AIDS, they contracted AIDS by blood transfusions in Pakistan. And recently, not very recently, in 1995 actually, the government of Pakistan made it mandatory for all the blood banks to test all the donors for HIV status, for hepatitis B and C. And these tests are provided free. At all the tertiary care centers, at all the public blood banks, and usually government sponsored to private blood banks in the private sectors too. So there are decreasing chances of contracting AIDS through blood transfusion.
Okay.
But because the AIDS test, HIV test by ELISA is very specific, and however, there may be a false negative rate also, and you cannot exclude it anywhere.
Right.
So
okay. We are short on time. We have about a few minutes to finish up. I would like to. We have about a minute more, so let's go ahead and talk about the society and how people affected with HIV, how they go ahead and integrate into society, and do they feel vengeance towards it, towards other people who are not affected by it, or if they don't have treatment towards it, to get. I'm getting. Okay.
Must wrap it up.
Okay. So basically, I'm going to go ahead and wrap this up. We are short on time. Thank you. I want to thank both of you for joining us today on Pakistani Point of View. And thank you so much.
Here in Houston, we offer services to the homeless children here. For about 23 years, Covenant House, Texas, has been offering programs, educational services on drug addiction, HIV awareness, and other services that probably most children don't have. They have about a 50 transient bed status along with 80 overnight. From anywhere, they say they're usually full capacities almost nightly. Here at the Covenant House, we're gonna try to be introduced to the educational program that kids off the streets come to, and what they have known as life services program or a life training program. Covenant House for 23 years has been a service and continues to be a service to the homeless kids here in Houston, hoping to remedy and stop the spread of HIV between young people. For the Covenant House, you primarily focus on young adults and children, ranging in ages to
age 21.
To age 21.
Yes.
And how young will you take them in?
10 years of age without a parent.
Without a parent. Now, I'm hosting Awareness of HIV and AIDS Day on December the 1st, so can you share with me and share with our viewers what the Covenant House does in educating the young ones and take us on a quick little tour? What services do you offer for HIV counseling?
Yeah, well, we have a comprehensive program here at Covenant House. We originally started as a crisis shelter, but quickly expanded because of the needs of the kids who are on the streets who come to us for services. And that's the primary population of young people we serve, those who don't have a place to live. Now, education is very important here at Covenant House. We, in fact, have an entire prevention program as a part of our outreach component that does prevention in the schools and in the communities. And here at Covenant House, we have life skills that every young person participates in 5 days a week. And part of that is AIDS education, HIV education, drug education as well, because we know that there's a connection, a correlation between drug use and HIV infection. And so we cover those issues in our life skills component. Then we have a case manager on staff who specifically deals with young people who are affected by HIV and AIDS.
Do you find a lot of support in educating the youth with HIV and AIDS, or do a lot of people not want to sit there and focus in on that, or do you all see that as a struggle?
A lot of the young people?
If someone in supporting for educating these youth, like going outsourcing this network, outsourcing this service, do you find a lot of resistance to that?
No, we don't. In fact, I think that people have come to understand that HIV is a part of the homeless population issue, that is something that needs to be addressed, and we do get a lot of support. In fact, we have a lot of collaborative relationships in the community with other agencies that help us to support in educating young people about HIV and AIDS.
Would you mind taking me to a quick tour, like if I was just someone new in the system, what a young person would have to go through for that?
Yes, in fact, we can start right here on these steps. Only a few feet from us at our medical clinic. And this is very important. We provide complete, comprehensive physicals to all the young people who come to our program. So since our primary focus are serving young people who are homeless, they can literally come in off the street and come into our medical clinic without ever coming to any other program. And they can come in here and see our doctors and our nurses to receive the services they need, including education, pre- and post-test counseling, and case management services as well. And so if we were to walk here, if you were a young person coming off the street, you would walk into this door. And it's as simple as coming in and meeting with our clinic nurse.
And so anybody can actually just walk in here. There's no charge for this? They don't need...
Free of charge. Everything is covered by the gracious donations of people in the city of Houston. And so they come in here free of charge.
If the child's nervous or scared to come forth or don't want to, I mean, do y'all still accept that? Or?
Yes, we do. And that's why we have clinicians like Rosalind Edwards. She's our nurse on duty right now. Young person simply comes up and tells Rosalind what they're here for. So it could be something as simple as a cough or a cold, or it could be something more extensive. But they tell Rosalind what the issue is. Rosalind then takes them to one of the rooms, the examining rooms, and we have a doctor and a nurse who then begins to work with that young person.
How many kids do you think you see a day here in the Houston area?
Area maybe between 8 and 10.
A day?
Yes. Sometimes as many as 6 or 8 for clinic, and then, you know, maybe a couple of walk-ins.
Can you share with me real quick how these kids that turn out to HIV, what they go through, what's the next step if they are positive for HIV?
If they're positive for HIV, we have a caseworker here, social worker here, that we refer them to. After we give them the information, then we refer them to our case manager, and she handles it from there.
You house young kids here, correct?
Yes.
Do you separate them, from the HIV positive from the non-HIV?
No.
So
No.
it's all
It's all,
lab?
yes.
And how can you, in your own words, someone that's been dealing with HIV or just comes to your clinic off the street, finds out that they're HIV positive, how do you think in your personal experience, how do they receive it? I mean, how do they opt for it? Is there a lot of anger, or how do you manage that?
Yes, when a young person comes in here, of course, most of the time they don't know that they're HIV positive. But after that news is given to them, of course, they're devastated by it. In most instances, they might have suspected that through having, risky sex or what have you, that they could be exposed. But getting that information is distressing. And that's why we have our nurses here and we have our case manager to help those young people to work through those emotions and then begin to start setting a plan for them to be able to effectively deal with it, both emotionally and physically.
What about assisting for funds for farmers for the antiviral drugs? I mean, a kid can't obviously afford to pay for this.
Right.
So how does that? Where does that come in? How does that work?
Right, and that's when we refer them to other community agencies that does that. As a case manager, Vera's job is to make sure that she finds those healthcare resources, and that's what she does. So she links them up with a healthcare provider who provides all those services to them. So no, it won't be any cost to them. Right. And of course, we receive Ryan White funding as well.
Oh wow, that's awesome!
So,
the young kid that died of HIV.
Yes, and so we receive that funding as well to support our case management component, which is vital, of course, to getting a young person what they need.
So you actually offer a dining service to the homeless kids here?
Yes, this is a residence building in the dining area, so every young person in our program gets 3 meals a day and snacks. And this is the area where the young people actually come and eat. And you see a few of them walking around right now. They're finishing up lunch. So they're, as a part of the program, it's a community type effort. And so we want all the young people to join in and helping us to maintain it. So you see them cleaning up right now.
And what's your name?
Brandy.
Brandy, how long have you been here at the Covenant House?
A total of 5 months, but because it's like that, it's because I've been in and out. I wasn't sure if I wanted to be here or not, so I've been in and out.
Can I ask you why you're here at the Covenant House? I mean, what?
The reason why I'm here is I'm not ashamed. It's because my sister, she stole $800 from me, and I was saving up my money. I work now. I've been at my job for almost a year. I've been there for 11 months. I work at Long John Silver's. And matter of fact, today I'm going to get my check, so.
That's a good day. So, can you tell me how the Covenant House has helped you?
It has helped me a lot because when I came here, I had no money saved up. And when I heard about the program that they have of CYBA, where it's for us to put our money in, I really saved up a lot now. It's not really a whole lot, but it's like $309 right now.
What I'm hosting is the HIV/AIDS Awareness Day. Do you know about HIV?
I know about AIDS. My mom died of AIDS.
And so can you share with me what you know about HIV?
What I know is that it's like, it's nothing good to have. It's something that people get by either sharing needles, unprotected sex, and all that. But thing is, my mom died of AIDS because she was messing around. I don't know if she was sharing needles, but I just know she was messing around. And then she died on February 14th of 2001.
I'm sorry, Brenda. So because of your personal experience, you've been educated.
Yes.
What do you think? You think there's enough education for the young people out here to learn about HIV and AIDS?
There sure is. We have a program every morning.
Here at the Covenant House. What about places that don't have the Covenant House or anything like that, like in schools or?
Yes, in schools definitely. There's clinics. Every school has a nurse clinic, and if you have a question about AIDS, HIV, or all that, or chlamydia or anything like that, a nurse there will sit down and talk with you, because I had helped a friend of mine at my high school who wanted to know the information by a nurse.
Where's that? Where was that?
I graduated from Reagan in the Heights.
Okay, so you've been in Houston for a while? Mm-hmm. Right on. And so, recommended to people out there, this is a good outreach?
Yes, it really is.
All right, well, thank you so much for talking to me, Brenda.
Right.
You're hot. Oh, you can have a hug. And so this is one of your classrooms.
This is our life skills area. This is where young people come for the education that we've been talking about, including HIV and AIDS education.
And this is Monday through Friday that a child would come in here and learn life skills of prevention and drug awareness and HIV and everything else.
Right.
Every day?
Yeah, it's
one
offered
class,
every day.
or is it 2 or 3 classes?
No, it's offered at 9 o'clock every morning.
And that's a voluntarily taken class?
That is something that we strongly encourage. Every program here is voluntary, but we strongly encourage young people to come to life skills, because it's really hard to make that transition to something else when you don't have any additional information. And so we strongly encourage young people to come to life skills every morning. And you can see by the configuration, sometimes there are small groups that are occurring here, and sometimes there are larger lectures. But this room serves generally as our place where information is transferred.
Well, Ken, I have to honestly say that you've changed my opinion about Covenant House. I'm more impressed and very proud to actually to being able to experience this.
Well, thank you. I'm
thank
happy
you.
about that.
Thank you so much, Ken. And as you can see, the Covenant House does offer educational programs to the young kids out there.
We're located at the corner of Yoakum and Montrose, and we've been here for about 20 years. Since 1983, we opened our crisis shelter to respond to the homeless needs of the young people. And so at the corner of Yoakum and Montrose is where we're located.
Is there a phone number?
Yes, the phone number is 713-523-2231.
And what about a website? Do y'all have a website or anything like that?
Yes, www.covenanthouse.org.
And is there always someone on staff here 24 hours?
We're open 24 hours a day to assist young people.
Welcome back to the last few. Thank Ilham Tirmizi for bringing in the Muslims Professional Health Society. I also like to thank the Pakistani Point of View, two aspects that I hope that y'all were able to learn and experience something. I also want to thank the Montrose Clinic, Brent Pendleton, the prevention supervisor, who came out and picked my middle finger here, so I can't show you the middle finger that the test came back negative. It's a simple test. You saw you could rub inside your mouth or do the pinprick, fill out a little Q&A. It is confidential, it is private, so get tested. You can get there and do that free at 215 Westheimer. I also would like to thank the Onyx limo service that gave her a driver, Michael, that would shuttle some of our guests to and for. Onyx limo service was dedicated and gave us a limo service, 713-269-6969. Thank you very much for that. I also like to thank Marshall for buying us lunch at Subway. That was very delicious. Appreciate that, Marshall. You can go by the Montrose Clinic and pick up some flyer pamphlets that will give you some facts and information on the test, the STD, and everything else. Carrie Hensley, I appreciate what you've done for us. Want to thank Jeffrey Faircloth. His perspective and his point of view was very forthcoming. Hope you learned something from that. Jimmy Carper and Judy Reeves, I appreciate both of them coming on. And want to thank for the Houston Media Society to actually allow this to be done. Now in closing, in our last 15 minutes, I have a very special woman. Y'all know her. She's very lovely in this community. She's been here part of this. Marc Cohen is joining us. But right now I want to welcome Annise Parker. She's a city controller, but she's not here as a politician today. She's here as Annise Parker. And my first question to you, Annise, is when were you actually introduced to HIV/AIDS awareness?
Well, actually, as we were waiting to go on the air, we were visiting about that in the early 80s. It was a very long time ago. We were very young. We were very naive. And we first heard about Kaposi sarcoma. And I was reminded of the McAdory House. And we used to do bake sales to fund it.
You were saying
we didn't know garage sales and bake sales, and I think a lot of us thought this was something that there'll quickly be a cure. Medical science will take care of this, and then we'll go back to our lives. And 20 years later, 25 years later, we're still dealing with it, and how frustrating that is.
There's been a lot of organizations that you've been part of. Marc Cohen, you are AIDS Foundation Houston. Today, y'all went to a luncheon to honor Joe Nelson and everything that he's done. Would y'all care to share some of that accomplishments over in those years? I mean, it's still going to be a struggling fight. And y'all haven't even relented it. But I mean, would you like to share?
Well, there's an annual luncheon for World AIDS Day, and the AIDS Foundation has been honoring folks in the community who have made a significant impact. Joe Nelson is the former president of the Houston Endowment, and while Joe personally has a huge commitment and he moved the endowment to funding AIDS very early on, the fact that Houston has been blessed with the Houston Endowment, the Jesse Jones money, made it possible for them to do great things, and Joe was the person who was the conduit for that. And then, of course, it goes to the AIDS Foundation, and they provide the services with that money.
How long has the AIDS Foundation been? How long have y'all been?
We've been in existence since 1982, and through the years, the face of AIDS and the face of our clients have changed drastically, and because of that, we've had to be in tune with those changes to alter programs to adjust the needs of the communities that we now serve. Vastly different than in the early days when Annise and I knew.
It was white gay men back
exactly.
then, and we didn't know that it would ever be anything else.
No. We were working off the information we had and trying to figure out services, whether it be Stone Soup, which was our food pantry, which is still in existence.
I've been part of Stone Soup for a while, yeah.
We had an information hotline back then that was taking about 1,000 calls that were all risk assessment related, because that was the only way people could get information. This was pre-internet years, so you couldn't access information readily, and it wasn't something that individuals were comfortable going to friends and family and discussing things.
It was very different being gay back then, and the fact that this is a disease that first struck in this country gay men. It was all tied up in homophobia and closets and sort of festering underground.
Do you still see some of that existing? Do you still see some of that that closeted scaredness out there? People not.
There's still a stigma with AIDS, and that's not so much. It's not the gay stigma now. It's that it's a sexually transmitted disease, and you have to talk about methods of transmission if you talk about AIDS, and that puts everybody's barriers up.
Educating.
I think a lot of those stigmas, they're not as obvious and readily seen here in the States. I had an opportunity to travel to Botswana, Africa, which has a high prevalence of HIV in January. About 40% of the country is infected. And the stigmas there in Central and Southern Africa are staggering. And it's not homophobia, but it's disease related.
And over in that reason is that they don't practice contraceptions. They don't use condoms in there, and then so it's the birth rate. That's why it's such a high number. Am I correct?
Well,
in
partly
that?
it's access to healthcare of any kind.
Mm-hmm. And going on the education point, where do you see the lacking in education? I try to emphasize the fact that in our high schools, in our schools, that parents and families are scared to approach the kids, and the parents themselves aren't educating themselves so they can educate the kids. What courses do you see in the future of us maybe initializing some kind of education to our young out there?
No, there's a government response to AIDS. There's a personal response to AIDS. There's the nonprofit community-based organizational response. There's a religious response. It all has to happen, and it has to be coordinated. And no one area can do the job. In terms of like educating high school kids, I now have a 9th grader, and I'm becoming much more aware of sex education and what we teach in school. We do a really atrocious job of sex education in general for our young people. And we have to talk about the range of sexuality, we have to talk about sexual practices, and we have to be blunt about it with kids. Not just about HIV and AIDS, but about sex in general and what it means and how they can protect themselves. We don't do it, and that's our own, as adults, that's our bias that enters into it, because the kids are desperate for information.
And isn't it a comfort zone? As a parent, how comfortable are you interfacing?
Darn it, Mark, you took my thing.
With your kids on this?
That's what I wanted to ask. Is like,
you know, it's the good news, bad news. Since we adopted older kids, we came to them from a different place, and we very early on decided to. We got the book. It's Perfectly Normal. Yeah. And we read it aloud to each other. But we've also, our older daughter, we have taken her to a counselor at Planned Parenthood, not for contraceptives or anything, but just a neutral person to sit down and talk to her about things that we weren't comfortable talking about. And I would encourage anybody who might be watching this to avail themselves of that kind of service that's available for their kids.
That's what I wanted to point out, Annise, as a mother, talking to maybe a mother that's sitting at home right now getting ready for their child to come home. As a mother,
if you can't talk about it with your kids, and I know it's hard, and we do some of it, but there were areas, it's not that we wouldn't talk about it, it's that she didn't want to hear it from us. And so we went and we found a counselor. There are some really great counselors who are trained in how to talk to young people. And I bet the foundation.
We do it through our education department as well, because you do bring up a very good point. The information, not only is there a comfort zone with the adult presenting the information, but how that young person is going to hear it. And they're going to hear it a little bit more readily. They're going to be more receptive to the information.
No one wants to hear their parent talk about sex.
Absolutely not.
And I mean, and plus, I'm sure that you on your staff, you have more of a relaxed, young, professional status. You don't have such an old man with glasses and looking down over here.
Okay, fine. But no, for our educators and even our volunteers, we try to have a segment of the community that is mirrored or will mirror the community that they are doing outreach and services to. We are in the process of developing a teen leadership forum for positive individuals between the ages of 16 and 19 to enable them to have the skill sets to enter into adulthood, because they're no longer dying. Their caregivers have not prepared them for adulthood. And at that program, we are looking at facilitators that are young people that can relate to what these kids are going through.
How can they get a hold of your foundation? I mean, is the website and a phone number if you want.
Our website is aidshelp.org, www.aidshelp.org, and the phone number is 713-623-6796.
Annise Parker, within about 2 minutes left here in the program, I want to thank you for taking the time out of your busy, I know it's a hard job to run a city like this. And Marc, I thank you I know you have a lot of work today, it's y'all's work day, but in closing, in a quick 2 minutes, what is the message you want to get out there to the people that are watching you right now?
It's what we've been saying for actually a couple of decades now, that AIDS isn't somebody else. It's about each of us, and that we each have a personal responsibility and a role in fighting this disease. Unfortunately, we have become a little bit blasé about it, I think, many of us. Now that we're living longer, we have new medications, new treatment protocols, but it is still a disease that no one should be catching. We know how to prevent it. We know how to stop the spread. No one should be catching AIDS any longer. It should be about treating the folks who already have it. And that message needs to go out. And the more we talk about it, the more comfortable we are of how AIDS is spread and how it can be prevented, the better we're going to do.
Marc, did you want to put a message out there to the people that are listening out there, someone of your experience and your expertise?
Just kind of echoing what Annise said, I remember years ago doing a presentation with a young African-American woman, and she looked at me and she looked at the audience and said, "This is the old face of AIDS." And as someone who was diagnosed in March of '87, yeah, I'm the old face of AIDS. But we've seen a change in the face of AIDS. And as a public and as a community, we have to understand that it reaches all segments. We cannot ignore a segment. We have to be able to educate them. We have to be able to provide them medical care and social services so that they can have a life that is meaningful.
And I want to thank Annise Parker and Marc Cohen, who have taken time out of their busy schedule to come down here and give that message to you, and hopefully you've paid attention to it. Go out there and get tested. You do not know. If you've never been tested before, you might be a carrier, you might be spreading it. Get tested. You saw how easy it was for me right here. Just a simple little pinprick, 20 minutes, you can find out. There are services out there, AIDS Foundation Houston, Montrose Clinic, PWA, People with AIDS Coalition. They're all on, you can Google, find that information on the internet. There's Yellow Pages. Contact them, talk to social services. Annise Parker works hard, Marc Cohen works hard to provide those services for you. Even if you're HIV negative, doesn't excuse you, it doesn't make you innocent. Don't get comfortable with the medicines. And if you are on your medication, remember, even if you are HIV positive, still use protection. It doesn't excuse you. I want to thank you for paying attention to this year's International AIDS Awareness Day, and hopefully we've made you that much aware. Hopefully we've educated you that little bit. And maybe next year we'll maybe do something a little bit better, but I appreciate it. Thank you so much. Hopefully see y'all next year. Bye-bye.